High blood pressure is a condition in which the force of the blood against the walls of your arteries is consistently too high. It can increase your risk of heart disease, stroke, and kidney damage, among other complications. So how can you tell if you have high blood pressure? Well, high blood pressure can go unnoticed for years without any symptoms. This is why it's often referred to as the silent killer. In this video, we'll discuss some of the warning signs and symptoms that you can experience when your blood pressure is too high, so you can take action before it's too late. Whether you're someone who has been diagnosed with high blood pressure or just looking to learn more about this condition, this video is for you. Number 1. Headaches. Blood pressure is considered normal when it's less than 120/80 millimeters of mercury. However, when your blood pressure is always high, it can cause a variety of warning signs, including headaches. Frequent headaches, especially at the back of your head, could be a sign that your blood pressure is too high. You may notice that you get headaches more often than normal, or that your headaches are more severe than they used to be. Number 2. Dizziness. High blood pressure can cause dizziness in some individuals. But it's also important to note that dizziness is more common if you are already taking blood pressure medications as a side effect. In addition, high blood pressure is a major risk factor for stroke, and feeling dizzy can be a warning sign of a stroke, so do not ignore it, especially if you have high blood pressure. Get your blood pressure checked whether you're taking medications or not. Number 3. Chest pain. Chest pain is another possible warning sign of high blood pressure. Chest pain symptoms caused by high blood pressure can feel different for different people, but they can feel like tightness, pressure, or discomfort in your chest. Some people describe it as feeling like being squeezed. Number 4. Difficult breathing. It's common to see people with lung diseases like asthma or COPD have trouble breathing. However, if your blood pressure is too high, you can also have difficulty breathing. High blood pressure can damage your arteries, leading to decreased blood and oxygen flow to your heart, which can cause heart disease. It can result in symptoms like shortness of breath, chest pain, and fatigue. As a general rule, you should see a doctor if you cannot do things you used to do because of shortness of breath. Number 5. Blurry vision. High blood pressure can cause damage to the blood vessels in your eyes, which can lead to vision problems. That's why it's important to detect and manage high blood pressure early with a combination of lifestyle changes like a healthy diet and exercise and medication if needed. So don't be that person who does not check their blood pressure regularly. Number 6. Nosebleed. Nosebleed can be a sign of high blood pressure, even though they are not very common. According to the American Heart Association, nosebleeding can happen in severe hypertension or hypertensive crisis, which is when your blood pressure goes up quickly to over 180/120 millimeters of mercury. And in this situation, you may need medical attention. But something to keep in mind is that you may not have any of these symptoms. So you may ask, how can you tell if your blood pressure is too high? Well, the answer is know your number. Get your blood pressure checked often, especially if you have risk factors for high blood pressure, such as a family history of high blood pressure, being older, being overweight or obese, or being an African American. And there you have it. Thanks for watching. I hope you find this video helpful. And don't forget to like, share, and subscribe to the channel for more health and wellness videos. Have a wonderful day. Bye.